Hi, I'm Rachel. I'm going to be your nurse today. I'm going to be doing a neurological exam. I'm going to assess your cranial nerves. I'm going to assess your sensory and motor functions of your arms and legs and just make sure that everything is going the way it should. Can you please verify your name and date of birth for me?
Sarah Ann Perry, 3/25/93.
Okay, so Sarah Ann Perry, 3/25/93, and I check her wristband. Sarah Ann Perry, 3/25/93. So I know I have the right patient. So the first thing I'm going to do is ask some questions. Have you had any issues with losing consciousness or passing out?
No.
No? Any mood swings lately? Muscle tremors or spasms? Involuntary movements at all?
No.
Any limping?
No.
Nope. Okay. Any seizures?
No.
Do you have any history of brain injury or
No.
no? Any surgeries, anything like that? Are you having any issues today with any of your senses?
No.
Okay. So now I'll do a physical assessment. I'm going to just make sure that you are oriented to person, place, and time. So just tell me your name.
Sarah Ann Perry,
Okay. And then tell me where you are.
Chattanooga, Tennessee,
Okay. And then can you tell me what's today's date, including the year?
July 17th, 2020.
Okay, so client is clearly oriented to place, person, place, and time. She is not having any issues speaking. She's not slurring her words. Everything she's saying is comprehensible. So we will go ahead and assess your cranial nerves now. So I'm going to name them each number and then assess each one as I go. So cranial nerve number 1 is the olfactory nerve. That's your sense of smell. So I'm going to just make sure you can smell this alcohol swipe. So just let me know if you can smell it.
Yeah.
Okay, so she can smell the alcohol swipe. Number 1 is intact. Number 2 is your optic nerve. To assess your optic nerve, I'm going to shine a light in your eye, so just be prepared for that. Okay, the pupils are reactive to light. They're round, and then, now look at me. Okay, and her pupils are accommodating as well. So that's her optic nerve. I'm also going to have you look at the Snellen chart. So what I'll have you do is look at the chart and then cover one of your eyes, so your right eye to start, and read the lowest line on the chart with the even number.
WXLTRS.
Okay, now switch eyes and then now do the odd numbers and read the chart.
QZKBW.
Okay, great. So she has 20/30 vision. Nerve number 2, the optic nerve, is intact. So nerves number 3, 4, and 6, which are the oculomotor, the trochlear, and the abducens. So those are your 6 cardinal gazes. Just make sure you can move your eyes around. So again, you're going to follow my pen. Great. So those nerves are intact. We'll go back to cranial nerve number 5, which is the trigeminal. So to test your trigeminal nerve, it's your facial sensation. So I'm going to have you close your eyes and just tell me when I am touching you with this soft rag.
There.
Okay?
Yep, my forehead. On my left cheek.
Okay?
And on my chin.
Okay. So that nerve is intact, number 5. Now we're going to go back or skip forward to number 7, which is the facial nerve. To test your facial nerve, that's the motor functions of your face. So I'll have you smile for me and frown and then puff your cheeks up. Okay, now raise your eyebrows. Great. Okay, so number 7 is intact. Number 8 is her auditory or her vestibulocochlear. So to test that one, I'm going to do a whisper test. I'm going to whisper a number, and you just tell me what number I whisper.
73.
Okay, now I'll check the other ear.
84.
Okay, so number 8 is intact. We'll go to number 9, which is the glossopharyngeal. To check that one, we would do a gag reflex test, which I don't have a time depressor, so we're just going to pretend and say, yes, she does have a gag reflex. So that was number 9, so we'll go to number 10 now, which is the vagus nerve. And then to check the vagus nerve, I'm going to make sure the uvula goes up when you say ah.
Ah.
Okay, so the uvula rose, so we know that her vagus nerve is intact. Number 10 is going to be the accessory nerve, and that's the muscles in the neck and shoulders. So to test that one, I'll have her push up against my resistance. Yep, and then try to resist my hand and turn your head. All right, now the other one. Great. So number 11 is also intact, the accessory nerve. And then number 12 is going to be the hypoglossal, which is her tongue and her tongue's movement. So to test that one, I'm going to have her stick her tongue out. Okay, now move it to the sides. Great. So that nerve is intact as well. All of her nerves, 1 through 12, are intact. So now we're going to assess your balance and your coordination. So to do that, I'll have you stand up. Just stand in place. Okay, now close your eyes and just stand in place. All right, she's not swaying. She's not having any issues with her balance at all. With her gait, she's standing perfectly fine. Now I'll have you raise one of your legs. Great, now switch. Okay, yes, and she's, so balance is normal. Now you can go ahead and sit, and I'm going to test your strength and your muscles and make sure that your motor functions are fine. So to do that, I'll have you stick your arms out and then resist my hands. Nice. Now do it, push down and resist. Okay, now grip my hands. All right, so her grip strength is equal bilaterally. Her muscles are 5 out of 5 strength in her upper extremities. Now I'm going to test her lowers. So I'll just have you push up and resist me. Great. Now do the same thing and pull back. Okay. So 5 out of 5 strength on her upper and lower extremities now. Now we will assess the sensations of your upper and lower extremities. And to do that, I'll have you close your eyes, and I'm going to use the soft rag again, and you're just going to tell me which arm or leg I'm touching.
That one.
Okay. And then this one.
That one.
And now.
Down there.
Okay.
And that one.
Great. So all of her senses in her upper and lower extremities are all intact as well. Now I'm going to check out the Glasgow Coma Scale, which I know that she's a 15 because she is eye-opening, she's not having any issues opening her eyes. She's looking right at me. She can obey commands, and she's oriented. So she has a total of 15 on the Glasgow Coma Scale, and I believe that is it.